Hello, everyone. I'm Rose Gerber, the Director of Patient Advocacy and Education for the Community Oncology Alliance Patient Advocacy Network. Today, we're going to focus on a topic that very few of us actually think about, and that is our health insurance. We don't think about it until we need it. We're now in the time frame of the year that is called open enrollment, and this is when individuals have the opportunity to review their insurance and possibly make changes. For anyone who has ever experienced any kind of illness, it can often be quite surprising and frustrating to find out that some of the needs that we thought were covered were not. And that can create a situation that adds more stress to a cancer patient and a family that might already be experiencing so much anxiety. Our special guest today is Kathy Oubre, the Chief Operating Officer from the Cancer Center, Pontchartrain Cancer Center in Louisiana. And I said that most people don't talk a lot about insurance, but Kathy does. She's a subject matter expert in this area. And today she's going to give us a lot of insight about some of the topics that you see on this agenda. What exactly is open enrollment? What are the ABCs of Medicare? Why are we even talking about Medicare? Isn't Medicare just for old people? What type of coverage can you expect to see? What coverage is best for you? And limits on what is covered. Kathy, thank you so much for sharing this information with us today. I do know that in your role, you and your staff have helped many cancer patients and their families make sense of everything that's covered. So hopefully we're all going to leave with a lot more information today as well. Welcome, Kathy, and thank you.
Thank you, Rose, and good morning, everyone. Thank you for having me today. So, I started on my health insurance journey many years ago, really more of in a selfish way. When my parents retired and needed to pick an insurance plan because of what I did for a living, they came to me. Then my husband's parents are one of 8 and one of 9. And so they all had health insurance questions also. But then, Rose is exactly right. Health insurance isn't very exciting. Doesn't exactly get you out of bed in the morning and something you want to read, but we never think about it until we need it. And in the cancer care world, it's really important to understand our health insurance, our healthcare rights, which is a separate subject. But it just kind of started us on this journey as Pontchartrain to better educate ourselves. So all of our staff, our providers, as well as better educate our patients. And it's really not just about Medicare. We're going to talk about open enrollment across the whole insurance gamut today. We will focus on Medicare a little bit later on, but it's really important that all of us understand open enrollment from that large health insurance perspective, with a focus on Medicare, because, we're all getting a little bit older. My AARP card showed up in the mail for the first time last month, and that's a little bit of a rude awakening.
Yeah, it is.
And even if I don't need it now, it's important for me to start thinking about it. And even if it doesn't affect you immediately, you probably have a parent, a loved one, a neighbor, that can benefit from some of this, depth of knowledge. So let's get started. Next slide. All right, so we're going to talk about open enrollment and what you should know. Next slide, please. I will go ahead and give my disclaimer that I am not giving you guys any type of legal advice or plan design advice. This is really just, my goal here is to help educate you. And if you have questions, I've included a lot of links that, hopefully will help you on your education journey. And then I do know that, the slides as well as this recording will be available to you all later for reference. So what is open enrollment? And I don't want to read the slides, but I'll just, kind of give you the snapshot real quick. So this is something that happens every year. Most people do have the ability to make changes to their health insurance, whether that is, through your employer. So for example, in our practice, we went through open enrollment last month. The employers typically are in the fall, but really, if you are still of a commercial insurance age, check with the person at your, with your employer, maybe that's HR or if it's a smaller organization, but they will be able to tell you those open enrollment dates. Also, the ACA marketplace, those Obamacare plans have a different open enrollment date. Medicaid also has a whole separate enrollment time, but what we're going to focus on today is Medicare because it is coming in October. Next slide, please. All right, so I kind of gave you my snapshot a little earlier, but let's go through these slides real quick. So open enrollment for employers is just at a set time every year. They do have to give their employees usually a 30-day notice that their open enrollment is coming. And it's that period of time every year for employed people to make some tweaks to your healthcare plan or to opt in. If for some reason you had health insurance through your spouse and now you want to go through this certain employer, it is that time during the year where you can either opt in, opt out, or make changes to that plan. For Medicaid, they do take applications year round. For the marketplace, those Obamacare plans, it does, it says it here on the slide. It's November 1st through January 15th. And if you do have questions, I've included lots of links. The ACA marketplace portion of the website is different than open enrollment for Medicare. And then lastly, Medicare open enrollment, which again will be the focus of our discussion today, is coming. So it is October 15th through December 7th with that effective plan year starting in January 1st of, these are the same dates for open enrollment for Medicare. It's always October 15th through December 7th with an effective date of January 1. Next slide, please. All right, so now we're going to step back a little and talk about health insurance broadly, because it is in the details when you're looking at plans and picking plans. So you'll have the types of plans, which would be either a fee for service, which means you can really just go to any provider you want, or a managed care system where the insurer will generally either give you a smaller network of, of providers, physicians, or something larger. So in that managed care, you then move into these types of managed care plans. So as I mentioned, within an HMO, you will typically need a referral from your primary care doctor, and then they would refer those out to a specialist or what have you. But that primary care essentially acts as a quarterback for your healthcare needs. In an HMO plan, it generally is a smaller provider, a smaller network of providers. So if you're looking to move from more of a fee for service or a PPO plan into an HMO plan, you might want to make sure that the doctors that you're seeing now are included in that new smaller network, or that you are okay with making that switch. As an aside, my mother-in-law did not take my advice, and she moved from a PPO to an HMO, and on January 10th called me very upset because her physicians were no longer in her network. You do have options if that occurs, and we'll discuss that later in the presentation today. So all is not lost, but there's no point in going through that headache if you don't have to.
Yeah, Kathy, I think that's so important. That might be one of the most important things you say today, because patients get so attached to their physician.
Mhm.
And I think anybody would react that way.
Yes.
But this is why we need to listen to people who know what they're doing, because
Well, yeah,
not having your physician, that really shakes you up.
it does. It does. And we'll talk about that later on. I mean, especially in the cancer care world, these relationships are, they're pretty deep.
They're very special.
The patients that we care for, it's not just the patients, it's their families. And, these are people that we see in the grocery store and at church and at Home Depot. And,
Mhm.
it's heartbreaking if all of a sudden, January 3rd, you can't see them anymore.
Right. It's devastating.
It is. It is. But if that occurs, all is not lost. And
Mhm.
you do have options, and we'll discuss that a little further down the line.
Thank you.
PPOs are really much more of an open access. So you don't need to go to a primary care to quarterback or get that referral. So, if you wake up and you feel like you need to go see a dermatologist, you don't need to get that referral. You can just call your dermatologist and make an appointment. Now, keep in mind that PPO plans tend to be a little more expensive because of that open access idea. So, when you're looking at plans and you get to make the decision, not through your employer, balance it against your healthcare needs and also what you can afford. Because the last thing we want to have happen, we want you to have a plan that fits your healthcare needs, but we also want you to be able to afford it. So, at our organization, again, when we are talking to patients about these things, it's also about making the financially responsible decision, because we kind of fail as an organization if we get you through your cancer treatment or what have you, and then you end up in bankruptcy on the back end. So, just balance this against, who you want to see, but what you can afford. Insurance terms. So you will have a monthly premium. That is with any plan that you pick. And that is just that dollar amount that you pay every month. So either, your employer might take it out of your paycheck, or if you're already in, the Medicare or Medicaid world or the marketplace, it might be something that you do have deducted out of your bank account, or you will receive that bill every month. An annual deductible is that amount that you have to pay out of pocket each year before your insurer starts paying. And that will vary per plan, and that will also vary by type of plan. And with Medicare Advantage typically being a much more upfront cost, whereas, original Medicare, so that's Medicare A and B plus maybe a supplement, it's really, you pay those monthly premiums are going to be more expensive, but the deductible is a lot less. All right, so I hope, I haven't bored you all yet. Stick with me. Co-payments are that fixed dollar amount that you're going to pay to receive medical care. So you might have a $20 copay for your primary care doctor. You might have $40 for a specialist, such as an oncologist. And in some plans, you will also have a separate amount for labs, x-rays, and ER visits and hospitalizations. So, it's really important that you read that explanation of what your plan covers and at what cost, so you're not blindsided. And then you will have co-insurance, probably. Again, that depends on the type of plan you pick. But what that is, it's the percentage difference in what your insurer pays for your medical expenses versus what you're going to pay. So, for example, Medicare, traditional Medicare, Medicare Part B, is an 80-20 split. And that's the way Medicare, traditional Medicare is. So Medicare in the Part B space, so that's when you go to the doctor, your chemotherapy, drugs, things like that, they pay 80%, and you will always be responsible for 20%. Then there's an out-of-pocket maximum. That is that dollar amount that you would have to pay, for your medical expenses during the year. Now, I'll give you, a quick little blurb into what we're going to cover later. Traditional Medicare, Medicare Part B, does not have an out-of-pocket maximum. So if you just fully elect to have Medicare Part B, it's a spoiler alert, guys. If you have Medicare Part B and no supplement, you will be responsible for 20% of those expenses throughout the entire year. It just keeps going until the plan rolls over the very next year. Next slide, please. All right, so let's now go over just the ABCs of Medicare. And then we'll do, on the next few slides, we'll do a little bit of a deeper dive into each piece. So Part A is hospital insurance. So that will include your hospital stays, if you need to go into a skilled nursing facility, nursing home, hospice, and some home health services. Then there's Part B, which is your medical insurance. So for most of our discussion today, that is when you go to see your physicians, be that your oncologist, a primary care, your cardiologist, and or if you receive any type of infusion services or injections. So these, again, are services from doctors, including chemotherapy, treatment infusions, injections, outpatient care, lab tests, ambulance services, and durable medical equipment. If you get chemotherapy through your port and you get the little, the cute little fanny pack where it runs through your infusion, Medicare Part B covers that infusion pump that you would go home with. Now, Part C. So those are Medicare Advantage plans, and we've all heard about them. Humana and United Healthcare are two of the largest providers of Medicare Advantage plans. Now, I want to spend a few moments on that because it does tend to be a source of confusion amongst a lot of people. So Part C, which is a Medicare Advantage plan, is an alternative to Part A and B. So if you elect to a Medicare Advantage plan, you will have coverage that is very similar to Medicare A and B, but you are essentially giving up what we know as Medicare Part A and B coverage, and you're electing into health insurance through a Medicare Advantage plan. So, and they typically do have prescription drug coverage, as you can see on the little slide here. You can elect within these Medicare Advantage plans to have a PPO Advantage plan or an HMO plan. And we discussed that on the previous slides. But these are Medicare approved plans, but they are run by private insurance companies. They're not run by, what we think of as Medicare at the federal government level. So you are electing out of them. So if you choose to do a Medicare Advantage plan for this coming year, and you show up to your provider's office on January 2nd and give them your Medicare card, that's not what they're looking for, because you have essentially opted out of it. What you will need to give them is that Humana, United, or a smaller Medicare Advantage plan card, and your benefits will look different. So that happens quite frequently at the beginning of a year in our practice. And so please, hope you understand that. So,
Kathy, can I excuse me, I just want to ask something that, and I might be wrong on this, but sometimes the audience might think this as well.
Yeah.
Isn't there a lot of controversy with the Part C, the Advantage plan, that it's not really an advantage? Can you elaborate on that a little bit, or am I hearing things correctly?
Yeah. Okay. So, Medicare Advantage. Okay, so, I'm not giving you guys, healthcare advice, but what I will tell you, and this is the way I explain it to my parents, Medicare Advantage plans are good for people of a certain age that really don't have a lot of healthcare issues or healthcare needs. Keep in mind, they come with gym memberships and lots of other things that sound good, but the devil is in the details on this. Medicare Advantage plans typically do have a much lower monthly premium cost, but they typically have a $6,700 deductible that you have to satisfy every year. And that's, so Rose, that's the thing. And that is typically where a lot of patients, they don't read what is in their plan, and they don't realize that they have to satisfy that $6,700 deductible. And in the chemotherapy world, if you're there for your treatment visit and it's January 5th, and all of a sudden you have a $6,700 deductible that's due, that can be quite sobering and quite scary. I look at what again, what is best for your healthcare needs and what you can afford. So if you want to opt into that that Part C plan, keep in mind that you need to have that $6,700 set aside to be able to probably access and blow through within 30 days. Because healthcare is not inexpensive. What I told my parents was, because my parents do have chronic illness, Medicare Part A and B with a supplement, a Medigap plan, which we'll discuss in a second. I tend to, in my experience, that has been better healthcare coverage for chronically ill people. Part D is prescription drug coverage. There are a lot of plans to choose from, and Medicare actually has some great links on their websites to help you pick the best prescription drug coverage. It's in some of my slides later on. You go onto their Part D website, you punch in your zip code, the drugs you're on, and it'll show you the plans available in your area and what is best suited for you from a cost perspective and a coverage perspective for your Part D needs. Next slide, please. All right, so I know we're actually already running out of time. Rose, I knew this was going to happen. And we did cover some of this already. So, these are the deeper dives into Part A. If you've paid into Medicare your whole working life, like most of us on this call today, your monthly premium is free. All of these numbers, by the way, are based off of last plan year. The 2024 numbers, as far as deductibles and premiums for Medicare A, B, C, have not been announced yet. So anything that you see on these slides, please keep in mind that it was for what's going on now. The 2024 numbers, so the deductibles, the premiums, and everything for Medigap plans does not get announced until generally October 1st or that first week in October. All right, so let's try to get through some of the other stuff. Drew, if you would go to the next slide, please. Okay, let's go ahead and keep going because I want to get to some. So let's talk about Medigap plans real quick. Medigap is what we consider supplemental insurance to that Part B. So if you decide to stick with original Medicare, which is at Part A for your hospital, Part B for your doctor's offices, again, you would have that 80-20 for your Part B. So in order to help you with that 20% in the Part B, there are Medigap plans available. They vary based on coverage, premiums, and deductibles. This website on Medicare.gov at the bottom, it does a very good job of breaking down all of the Medigap plans and helps you compare plan benefit. With included on the next slide, Drew. So these are the benefits that were based for this plan year for 2023. This is what was covered. And so keep in mind, if you're a big, if you travel out of country a lot, like my parents did, please keep in mind that not every Medigap plan covers you while you are out of the country. And be very clear if you travel, and even if you decide on a Part C plan, a Medicare Advantage plan, keep that in mind, because if you are in Canada, or one of my husband's aunts was in South America and she had an accident, she did not have foreign travel coverage, and that got very expensive very quickly. So again, pick your plans based on your needs, what you can afford, and your lifestyle. Next, please. All right, so I've kind of covered this with you guys. You know, when should you buy that plan? If you decide to roll in plan A and B, you really do want some type of supplemental help with that 20%. There are Medigap plan enrollment times, and that's in this second slide here. You basically have a 7-month window before you turn 65 and for a few months after. If you wait to get a Medigap plan till after that little 7-month window, you can still get a plan, but it might be a little more expensive. And the only way a Medigap plan will be canceled on you is if you fail to pay your premiums. So just keep in mind to do that. Next slide, please. All right, so some little known facts. And this is actually important. And then we'll try to get through the last pieces. With Medicare, you do now have free annual wellness visits and free preventative care services. And Medicare does not cover. And so keep in mind, as we get a little older, again, my AARP card showed up last month. It does not cover long-term care. So again, as we get older, you might, just keep that in mind. Medicare does not cover that. It does not also cover dentures, cosmetic surgery, acupuncture, hearing aids. That's up for discussion another time, but that was a rude awakening for my parents. It was not covered, but just keep those things in mind. The other thing I wanted to mention, and it's not part of open enrollment, but it is something I want to mention while I have you all on a call today. Chemotherapy, cancer care, it's expensive. And you all have health insurance, hopefully. If there's, a point in your healthcare journey that you're having trouble paying for those chemotherapy drugs, please talk to your provider about financial assistance. Almost every provider has financial assistance counselors. And, we do this every day. We find assistance for almost all of our patients that are getting any type of chemotherapy. So if you're still in the commercial care space, so through an employer, then we typically can get you copay assistance from the pharmaceutical manufacturer for the particular drug that you're getting. If you are on Medicare, Medicare Advantage, or on Medicaid, there is still assistance available for you through foundations, and based on your income, you might qualify for a free drug program through that particular drug's manufacturer. But please don't think that you don't have options to help afford your care. just please talk to your provider. That's one of my bigger takeaways for you guys, especially as you go into next year and deductibles reset. Healthcare gets very expensive at the beginning of a year. And so start talking to your providers about your options as you move forward into next year. And, we really are out of time. But when I said all is not lost, if you pick a plan that you don't like, I know, Rose, you're about to give me the hook.
No, not at all. I mean, I think, definitely people always have the option to exit if they need to, but you can also, Kathy, if you want to quickly go through some of your slides and just, to the audience, we always have this on YouTube and on our Facebook page. But it's up to you if you want to quickly go through some more information. So if you elect into a Medicare Advantage plan, a Part C plan, as Rose mentioned earlier, and let's say, January 15th, January 5th, at one point you decide, I made a mistake. It is not the right plan for me. Don't panic. Yeah. The way healthcare is designed is you actually have the option from January 1st to March 31st of that new year. If you enrolled into a Part C, a Medicare Advantage plan, and you think that wasn't the right choice for you, you are allowed to roll back into traditional Medicare, Part A and B. Now, getting a Medigap plan might cost you a little more upfront, and there are some caveats in the later slides, but it remains an option for you guys. So please just know that, Medicare tried to design healthcare really so you had a lot of coverage choices and you really wouldn't be unfairly penalized. So I just wanted to make sure you guys had that as a salient takeaway today. Next slide, please. All right, so I'll just let you guys reference this slide later on, but it does talk about how to enroll. What happens if you don't sign up during that time near your birthday? Again, that 7-month window, the 3 months before or the 3 months after, or during that open enrollment period, again, October 15th through December 7th, when you have which is that window to move around and make changes. You do have options, but try to do your best on educating yourself now. The numbers aren't out yet, but you can look at what was going on in 2023, talk to financial counselors at the practice that you see through your provider. A lot of them do offer these services, or they'd be willing to, sit down and talk with you. The financial counselors, though, are not there to pick plans for you. They're generally not going to help you enroll, but they will be happy. I called several yesterday, even at my own practice. We're happy to sit down and talk with you and educate you. And what we typically do is I will look at what happened in your healthcare journey across 2023. And I will look at, okay, this is what you had. This is the health insurance you had. If you opted into something else, this is what it would look like financially. I'd break down your premiums, your deductible, and what your costs would look like. Keep in mind, we can't do that yet for 2024 because the numbers have not been published, but this is that time to start educating yourself and maybe make an appointment with that financial assistance counselor at your doctor's office for when those numbers do come out. Next slide, please. I think we've already covered it, but if you want to switch between your Medicare options, these are your choices. If you want to go from original to a Medicare Advantage plan, Medicare Advantage back to original Medicare, or even switch between MA plans. Next slide, please. Kathy, and we do have 2 questions. Would you like to, can I address those real quick? Just to.
Yeah.
Or can you see that? Okay, so one question is, and you may have covered this, but let's go ahead and ask this. If you opt out of traditional Medicare A and B for a Medicare Advantage plan, but later finds you can't like it, can you go back to traditional Medicare A and B? And I believe you said yes.
Yes.
Okay.
And
So we're
during that, usually it's the first 90 days of a year, but just know that you can opt back into A and B, but if you need a Medigap plan, there are some caveats around that.
okay. And I'm going to read this a little bit slower. It's a little bit longer. I've been told that once a person chooses a Medicare Advantage plan, that they cannot switch back to Medicare. Okay, seems kind of similar. How easy is it? How easy is it to make this change back? Also, so it's a two-part question. Also, I've had some patients who choose Medicare and then they were changed to Medicare Advantage plan without their consent. Ooh, that's interesting. It took some time, but they managed to get things corrected. How can this happen? Okay. So did you catch that? There was two questions.
And I'll leave it up. I have it.
Okay, good. You can see it as well. Great.
Hey, Jeannie. Good to see you. Thanks for asking. Okay, so it's up on the Medicare site, and yes, if a patient chooses a Medicare Advantage plan, they can opt back into traditional Medicare, but again, only during those first 90 days of a year.
Okay.
So, as far as patients being changed without consent, I've not heard of that. And patient signatures are required, when you're filling out enrollment forms. So, I really can't speak to that. So I have no idea how that would happen. But that shouldn't happen. If that were to happen, I would think that's rather illegal. But again, signatures are required, patient's consent is required, but again, A and B, 90 days you can move back, but it might harm you if you need a supplemental plan. All right.
Thank you, Kathy.
Yeah. All right, let's keep going, Drew. Okay, so again, I really wanted to hammer this home with you guys that you have options. That's the biggest thing. CMS, Medicare, federal Medicare, they really did try to give patients options and windows of opportunity in case you made a decision that you had regret on. You do have options, but notice this again on the very last line here. After that Medigap enrollment period, your options to buy that policy, they may be limited, they may cost more. One of the things that came out of Obamacare was, you couldn't deny people anymore based on a pre-existing condition. Now, when you need a Medigap plan, if you get that plan during regular open enrollment period, that they can't deny you coverage. If you don't opt into that plan and you decide later down the line during a non-open enrollment period, even those 90 days, and you want a plan, you might have a sit-out period for your healthcare issues, and it might be a little bit of a while, but ultimately after that sit-out period, they will enroll you into that supplemental plan. All right, next slide, please. So as you're preparing for open enrollment, take a look at your current health care needs. Look at your current plan, and your insurer is required to send you an annual notice of changes. You should be receiving it if you have not already. It'll be coming within the next 30 days because they are required to tell you by law of any changes that they are making for the next plan year. So take a look at it. It's really boring reading. It's great bedtime reading, but it is important. Then please look at your budget. Healthcare needs, your current plan, and what you can afford. and compare plans. Medicare, again, has some really good resources on their website to help you compare plans and pick what's best for you. Next slide, please. All right, guys, thank you for your time today. I hope that wasn't, I hope your eyes didn't glaze over and, go get another cup of coffee. As you're heading into open enrollment, I wish you all the best and good luck. Thank you for having
Thank you, Kathy. And we have one more slide. And Kathy, I just think something that you really drove home, and I think is very important. It's like the devil's in the details, because it's so easy. You said it yourself, is it's not something that most people get excited about. So, I mean, I'm guilty of it. You look at something and it's a lot of text and you're like, oh, it's fine. But it's, you've demonstrated that it really does make a difference when you're actually sick. And you don't want to be in that situation. So thank you again for sharing your information with us. I'm really excited about our two presenters next month, and this is the role of pharmacists in community oncology. We always talk about oncology nurses, oncology social workers, so many people that have staff positions that make community oncology as great as it is. But few people know what an impact the pharmacists play in community oncology. And you can see our guest is going to be Jonas from Chief of Pharmacy from Hematology Oncology Associates of Central New York, and Judy Alberto, who is new in her position. Well, she's been with us for a little over a year now, who's the Director of Clinical Initiatives for COA. So they're going to have some very interesting insight, and I hope you can join us. Thank you again for joining us today. Enjoy the rest of your day and the rest of your week.
Bye, guys.